Good afternoon, viewers. Today, on the occasion of World Hepatitis Day, we have with us Dr. Naveen Polavarapu, Consultant Gastroenterologist and Transplant Hepatologist, Apollo Hospitals, Jubilee Hills, Hyderabad. Good afternoon, sir.
Hello viewers.
Sir, what are the functions of liver in the body and how is it important?
See, liver is a very important organ of the body along with the kidneys, heart and the lungs. Liver is the largest organ, solid organ of the body, and it is situated in the right side of the tummy, upper part of the tummy. So liver does more than 500 different functions, and major functions is like kidney, it acts like a filter. So liver, it helps in metabolizing and also filtering all the toxins from the body. Along with this, the food that you take, it gets digested from the intestines and absorbed from the intestines, and they actually reach the liver, and that's where all the metabolism of all our nutrients, fat, carbohydrates, proteins, everything happens in the liver and gets distributed to the rest of the body. Along with that, it does help in synthesizing more proteins in our body, which help in preventing clotting whenever you have any bleed. Okay, so liver does more than 500 different functions, and along with the kidneys and the heart, as I said, this is one of the very important important organs of the body.
What is hepatitis?
Hepatitis is nothing but inflammation of the liver. So anywhere itis is inflammation, and because it affects the liver, that's why it's called as a hepatitis. So any inflammation that happens to the liver is called hepatitis. Now commonly hepatitis is associated, or we commonly hear about hepatitis with viral hepatitis. Now we'll come to that point in a minute, what is viral hepatitis, but along with the viral hepatitis, there are so many other reasons or causes which cause inflammation to the liver. Like for example, we already know number of times that alcohol causes a lot of damage to the liver, and that's what we call alcoholic hepatitis. Along with this, excess fat in the liver can also cause damage, particularly people who got diabetes, blood pressure problems, cholesterol problems, or have excess fat around the tummy. This fat gets deposited in the liver more quickly and can cause similar damage to what virus does and the alcohol does. It causes hepatitis or non-alcoholic steatohepatitis or inflammation to the liver, and it causes further damage. Inflammation after inflammation reaches the stage of scarring or what we call fibrosis, and that subsequently leads to the stage of cirrhosis, which is irreversible damage of the liver, which will come to in a minute. Now along with this, these are three main causes. Along with this, there are so many other 100 to 150 different reasons why liver can get affected with different types of inflammation.
What is viral hepatitis?
Yeah, as we said, viral hepatitis is nothing but the viruses which cause inflammation and damage to the liver. Now there are different types of viruses which attack the liver. Now so far science have discovered about 5 different types of hepatitis viruses. There are hepatitis A, B, C, D and E. Now every virus on these A to E viruses have different modes of transmission, different modes of damage to the liver. For example, hepatitis A and E are generally transmitted through fecal-oral contamination. So food contamination or water contamination leads to these viruses, infection because of these viruses, hepatitis A and E. Now hepatitis A and E viruses generally are self-limiting infections. Majority of the times people come out of these infections without significant damage, although initially they cause jaundice and a lot of inflammation, damage to the liver. Very rarely they can lead to what we call acute liver failure, where liver gets very badly damaged to an extent that it doesn't recover, and at that point either people die or they would need a liver transplant. Now hepatitis B, C and D are transmitted through blood and body fluid contacts. Now hepatitis B is transmitted primarily through blood and also with the body fluids, like for example saliva or through the semen or vaginal fluids. It also gets transmitted through sharing needles and also through sexual transmission. Now the other important route of transmission for the hepatitis B is through mother to baby, what we call a vertical transmission. So a mother who's got infected with hepatitis B, that can transmit the virus to the baby during the delivery time, and the baby can get infected. Now, hepatitis C virus is transmitted mainly through blood products, through blood transfusions, or through sharing unsterile needles or having unsafe unsterile dialysis practices, and also having tattoos and piercing can also cause hepatitis C virus.
So, what is the disease burden of this viral hepatitis?
Yeah. Now, you'll be surprised to know that hepatitis B virus and hepatitis C viruses, which are the common viral hepatitis, are very, very common. In fact, it is estimated that around 200 crore population has already been infected, and some of them have cleared the virus, but that is 200 crores is, well, Indian population is 130 crores, so you know the 200 crores is much bigger than the second largest population of the world. So it is very, very common infections, and roughly it's estimated that about 35 to 40 crore people are currently infected with these viruses, carrying these viruses and spreading these viruses and causing damage to their own liver. Now, the worrying part is that 9 out of the 10 of these people do not know that they have a virus, because this virus is like a silent killer. It stays in the liver for a long time, and only when it is severely damaged, then only it declares with symptoms, and by the time when symptoms come, already significant damage would have happened to the liver. So, as I said, the burden is very high. In fact, it is 5 times more common infection than the HIV virus. We know about HIV, how serious and dreadful this disease HIV is. This is 5 times more common and more serious than the HIV infections.
How do we diagnose hepatitis?
See, hepatitis these days are very simple to diagnose. All you need to do is just blood test. Okay, so one blood test will clearly tell us whether they have this infection or not. Often, as I said, this gets undetected. As I said earlier, 9 out of 10 people don't even know that they have the virus. And often when people come for, like for example, surgeries or having a general health checkups, that's the time when we actually pick up that they got these viruses. So when we detect these viruses, what we do is we check the stage of the virus, but also we look at the damage that has already happened to the liver. Based on these two, we decide whether treatment is needed and what type of treatment is needed. So all you need to do, ladies and gentlemen, is regularly get a hepatitis B and hepatitis C check blood test, and that will tell us all this information about these viruses. And don't forget, these viruses are preventable viruses, and they are definitely treatable viruses. If not treated, this definitely will lead to serious damage to the liver to an extent that it causes cirrhosis and liver cancer. In fact, 3 out of the 2 liver cancers that happen in the world are because of hepatitis, viral hepatitis, hepatitis B and C. So it is very common, and it's a very dreadful disease. So it's very important that we check it, especially because it is a silent killer and doesn't give us any symptoms. So its onus is on us to get it checked and then get it treated if needed.
Sir, what are the symptoms of hepatitis?
Yeah, as I said earlier, liver is such a brilliant organ, but it's a blessing in disguise because it copes till it is at least 80 to 90% damaged, and by the time it declares about the symptoms, it's very badly damaged, and most often they present with irreversible damage. Often when they do present with this liver damage, the symptoms we generally tend to come across is jaundice, or having yellow discoloration of the eyes, or passing yellow urine. They can get tummy swelling, what we call fluid in the tummy. Sometimes they can get swelling of the legs. Sometimes they present with bleeding, blood vomit through the mouth or through the back passage. Sometimes they present with drowsiness. Often they have infections on board and they feel very, very unwell, weakness. They start losing the muscle mass, and they'll start having a lot of fluid around in their body. So that's how they generally present when they do present with symptoms. But as I said, by the time they present with symptoms, it's already quite badly damaged liver.
Once diagnosed with viral hepatitis, how do we treat them?
Yeah. So as I said earlier, so when we actually diagnose that somebody has got hepatitis B or C, we check the stage of the virus. How much is the virus count and what stage is it? Is it infective? How high infectivity the virus is? Along with that, we also check how much damage has already happened to the liver. So based on that, there are different treatments which are available, which can cure the virus or certainly control the virus. Now hepatitis B and C treatments are slightly different. Now hepatitis B, unfortunately, so far science has not detected or invented a treatment where we can completely eradicate the virus. But there are very, very good treatments which help in controlling the virus, and ultimately the aim is to control the virus and control the damage that happens to the liver. So in other words, we have indirectly achieved what we need to in controlling this virus. So there are treatments available for hepatitis B to control the virus. Now hepatitis C is a different story. In fact, we should say that as one of the biggest success stories of medicine in the recent years, because hepatitis C was only discovered in 1992. And when we detected, there were hardly any treatments available. And this virus, once it's in the body, once we acquire or get infected, 80% of the times the virus stays in our body and causes damage to the liver. And in fact, there is something called baby boomers, where suddenly there was a big surge of this hepatitis C virus throughout the world. And this virus, as I said, it stays in the body and causes damage to the liver and leads to the liver cancer. And so far, as of now, the most common indication why people go for transplant for liver cancers is nothing but hepatitis C. So now these days we have such an excellent treatments available. Is just one tablet a day with very, very little side effects. We can completely eradicate this virus. The chance of success of removing this virus from our body is almost at the stage of 98 to 100%. So compared to what it was, where we could not cure the virus, we did not know about this virus, we could not cure it, and even if we had to cure it with medications, there were very bad side effects with a very poor success rate. Now we've got excellent treatments available which can completely cure this virus. Okay, so hepatitis C is a kind of an easy treatment now these days, because we can give tablets and we can eradicate this virus. Now hepatitis B has got good vaccinations available which can completely prevent getting these infections. The vaccinations are almost 98 to 100% effective in terms of not getting these infections.
What is the treatment of CLD? Now,
once the patient reaches a stage of what we call chronic liver disease, that is nothing but an irreversible damage, the scarring that has happened to the liver. Okay. Now, liver, as I said, such a brilliant organ. If you kind of stabilize or remove the insults, for example, in the case of viral hepatitis, if you control the virus, or if it is alcohol related, if you control the alcohol, stop the alcohol, liver stabilizes. Okay, you just need about 20 to 30% of liver to work for us to stabilize the patient. Okay, now once they reach the stage of cirrhosis, they start developing all the complications which are developed, which I have mentioned earlier, which like for example, developing ascites or fluid in the tummy, jaundice, blood vomit, black motions, and all these things. Now we have to control all this disease, all these complications. So there are treatments available. Obviously they'll have to be admitted in the hospital and give aggressive, thorough treatments for these patients so that we can control or stabilize the liver. Ultimately, once it reaches a stage where it cannot cope with any of these complications, then we will have to go for a liver transplant, which is nothing but changing the liver and getting a new liver into our body.
So we have a few questions from our viewers.
Sure.
What are the symptoms of fatty liver?
Good question. See, often we're hearing these days about fatty liver. Okay, fatty liver is nothing but excess fat depositing in the liver. Okay. Now, as I said earlier in my talk, there are three big elephants in the room which cause damage to the liver. One is the viral hepatitis, the other is the alcohol. The third most common thing is the fatty liver. In fact, it is estimated that because the world is getting so obese these days, about 20 to 25% of the population currently is obese, particularly in the Western countries. It is estimated that the incidence or the risk of fatty liver related complications are going to go up significantly, and by 2050 it is estimated that the most common indication for liver transplant is going to be fatty liver and its consequences. Now, as I said earlier, liver is such a brilliant organ, it doesn't give any symptoms till it is damaged or reaches the stage of cirrhosis. So if you ask bluntly what are the symptoms of fatty liver, you won't have any symptoms. It does not give any symptoms to you. You just have excess fat deposited in the liver. It silently damages your liver till it reaches a stage of cirrhosis or irreversible permanent damage to the liver. Okay, so again, we pick up these fatty liver often when people come for a scan, ultrasound scan, or for some blood test for other reasons. Okay, again, they don't have any symptoms, but it's important that we control this fatty liver in early stages so that it doesn't reach the stage where it is irreversibly damaged. So watch out for fatty liver, watch out for your diet and lifestyle. These are all the lifestyle diseases. Watch out for all these things. Tightly control your diabetes, blood pressure, cholesterol, all the risk factors. Keep yourself active. At least do 30 minutes of brisk exercise every day and eat healthily so that you don't get excess fat depositing into the liver and causes further damage.
So another question, what is autoimmune hepatitis?
Again, as I said, the three most common reasons why liver gets damaged, but there are 100 and 150 different reasons why liver gets damaged. One of the other reasons is the autoimmune. Right, now we have soldiers of our body which protect our body from infections. Okay, these soldiers, when they think or assume that the liver is a foreign body or an outside substance, and they start attacking our liver, so our own immune working and damaging ourselves like an autoimmune process. When that damage happens in the liver, it is called as autoimmune hepatitis. Now, as I said earlier, it is the inflammation which happens in the liver, whether it's because of the autoimmune or our own soldiers damaging the liver, or whether it's alcohol, or whether it is related to virus. The damage is the same. It causes inflammation. Further inflammation leads to scarring in the long run, and that scarring leads to non-functioning and distorted structure of the liver, and that further leads to the cirrhosis.
Sir, how much alcohol a day is permissible for a healthy person?
Okay, now I knew that this question is going to come. Again, we say that don't drink alcohol. If you drink alcohol, drink it in a limit. But to give a brief example to you, a simplistic example to you, 1 liter of wine contains about 12% alcohol in it. Similarly, the whiskey contains around roughly about 42 to 48% alcohol in it. 1 liter. Okay, so 1 liter of wine, which is 12%, has got 12 units. So we'll measure it in units. Okay, so 1 liter of wine has got 12 units of alcohol. Okay, so 1 liter of whiskey similarly has 42 to 48 units of alcohol in it. Okay, the recommended limits of alcohol for a male is around 18 units per week. Okay, and for the female it is about 14 to 15 units per week. So you can roughly estimate based on what are the examples that are given. There are different type of measurements. If you look on the Google, it will tell you measurements per glasses, per beer, wine, and the whiskey. So you can measure it, but I'm just giving a small a simplistic example that a liter of wine which contains 12 units has 12% contains 12 units, and the recommended limit is about 18 units for a male, and a female is about 14 to 15 units per week.
Sir, another question. My LFTs are beyond normal, including total bilirubin, but from 1 month I have been suffering from discoloration of eyes. Discoloration of my eyes. So what should I do now?
Well, if you already have jaundice and your liver enzymes are abnormal, you definitely need to consult a liver specialist, because as I said, there are different reasons why liver can get damaged, and as I said, about 100 different reasons, and we need to evaluate one after the other very quickly and thoroughly, because if left untreated, liver, if it reaches a stage of severe damage or cirrhosis or having acute liver failure where liver gets necrosed or dies inside, then you will end up in big problems. So I would certainly urge you to see a liver specialist so that we can evaluate the cause and also to assess the severity so that we know which direction we're going in. So certainly I would not ignore if you're certainly jaundiced and having abnormal LFTs.
Sir, another question from one of our viewers. Hello sir, my father has been diagnosed to have chronic liver disease and he was advised a liver transplantation. We were planning to go for a live donor transplant and I am the donor. I have a lot of apprehension regarding the same. can you briefly tell us shortly about the live donor liver transplantation, the risks involved in donating and also receiving the liver?
Okay, very good question. So before I answer about the live, let me just talk a little bit about the liver transplant. As I said, liver transplant is done for the people who got irreversible damage to the liver and who develop complications which can't be treated with medical treatments. So those are the patients which we suggest to go for a liver transplants. And the other indication is when you have acute damage to the liver, like acute liver failure or very rapidly damaged liver, those are the patients which we go for a liver transplant. The other third reason is the liver cancer. So again, liver cancer, we look at the different sizes and stages of the liver cancer, and then we recommend a transplant as one of the treatments if it is in the early stages. Now, liver transplant, there are two types of liver transplant. Okay, one is called cadaver transplant, the other is the living donor or live donor transplant. Okay, now cadaver means nothing but, so for example, somebody dies of a road traffic accident, a donor. Okay, so the donor or the person who had a road traffic accident has got good working liver, but unfortunately died because of the road traffic accident. He's a brain dead person. Then we can take his liver and then put it to the recipient who gets the liver, who's got cirrhotic liver. So we remove the bad liver and we put this new liver. Okay, that's called a cadaver transplant, cadaver related liver transplant. Okay, and the other is the live donor transplant. Okay, so live donor transplant, the reason why we actually can do a live donor transplant is liver is such a brilliant organ, it regenerates. Okay, so for example, in your case, you want to donate your liver to your father or your mother. Okay, so you got 100% liver. You can donate up to 60% of your liver to your father. Okay, now you'll be left with about 40% of the liver. Now this 40% liver regenerates. It actually regenerates, and by say 6 to 8 weeks, you will have a full 100% functioning liver. Okay, similarly, your father, who is the recipient, who got 60% liver, that also regenerates and becomes 100% liver. So by 2 months, roughly around 2 months, you will have 100% liver, and your father, who you donated to, will also have 100% liver. So you saved life somebody by giving part of your liver, and yet you are well in yourself. Now it is, of course, there are risks with everything, but risks are such a minimal thing, which I'll come to that in a minute. But understand that if it is a risky surgery or a transplant or a procedure, we would not be doing, or throughout the world there are more than 1 lakh transplants which has happened so far, and we would not be doing so many transplants if it is not a safe operation. Okay, now imagine the first thing that we actually learn in medicine is do no harm. Okay, so if it is a harmful or risky surgery, we would not be doing liver transplants or live donor transplants throughout the world, so many cases. Okay, so your risk is very minimal, especially because you're a healthy person. We take equal and even more important precautions to make sure that your liver and you are yourself are safe and stable, and you are fit enough, and that you don't have any long-term complications. Now, as I said earlier, anything has got risks. Even walking on a road, we do have risk of accidents and stuff. So of course it's a surgery, so it does have risks, but as I said, risks are very, very, very minimal. Okay, so we talk about risks of infections or leak of the bile or any bleeding. The risk of that is probably 1 in 1,000. So out of 1,000 times, if somebody donates a liver, the risk of having any of these complications like leak or bleeding or infections is about 1 in 1,000. Okay, so it's a very, very minimal risk. Okay, but having said that, the amount of the benefit that the person gets, the recipient, is immense. And as I said, you will not have any long-term complications. You would be having 100% normal working liver within 2 months, and there would not be any restrictions on your lifestyle or quality of life in the future. It's as good as after 2 months, it will be like you would not even realize that you had a liver transplant. You would have donated a liver, because liver regenerates and it does the normal function as you would have had it before donating the liver. So if, of course, the doctors, the liver specialists, we assess the live donor and also the recipient, and we carefully go through all the things, like we check your heart, lungs, your infection risk, your liver, your volumes, how much of liver, how much part of liver we need to take out, how is your anatomy of your liver, how are the vessels running in your liver. So we do all those roadmap, all the workup before we actually put you on the knife for the transplant. So don't worry, you're absolutely safe. We go through all the precautions, we take all the things, and then only we would advise to go for a live donor transplant.
Sir, what is the treatment for autoimmune hepatitis?
Now, as I said, our own soldiers are damaging the liver and cause inflammation. Okay, so treatment is opposite to that, which is kind of dampening our own soldiers to a certain extent so that the inflammation doesn't happen. There are also medications which help in controlling the inflammation, what we call anti-inflammatories. Okay, for example, steroids is a very good anti-inflammatory which we give to dampen that inflammation and also to reduce the potency of these soldiers of our body. Now with that, there's a small risk of acquiring infections. Now the soldiers are there in our body to protect infections, and when you're actually disarming them, so infection risk is there. Okay, now it's a calculated risk that we take, and so far there are a number of good drugs which are available which control this in autoimmune hepatitis in a very good way, and so that it doesn't lead to further damage. So don't worry. If you do have autoimmune hepatitis, there are excellent treatments available. Talk to your liver specialist and then get the inflammation under control. But as I said, this is an ongoing process, so you will have to take these medications for long term so that we dampen the inflammation in your liver.
Is there any specific diet for liver health?
Now, as I said earlier, it's all the lifestyle diseases that we have that is the reason why we get liver diseases. Okay. Now, I kind of covered this point earlier when we discussed about the fatty liver. It is about eating healthily. Okay, and also making sure that we do exercises, enough exercises, so that we keep ourselves fit and active. Okay, so having a balanced diet, having an adequate amount of protein, carbohydrates, even fat also, vitamins, minerals in adequate quantities, and making sure that we do enough exercise are very, very, very important. Now, as I said earlier in the earlier part of my talk, liver is like a filter. It is the largest organ, and all the metabolism, it's like a big chemical factory of our body. So it does a lot of functions. So for it to be protected, and as I said, that's where all the metabolism happens. So if you eat healthily, the liver gets healthy stuff into it, so it can do a better metabolism, and therefore whole of our body, not just the liver, whole of the body will have a healthy atmosphere, so that it will help in for our healthy bodies. So it's very, very important that you eat healthily. So good nutritious diet, at the same time exercise is very, very important.
Sir, actually this is one of my questions. Many times we hear that when somebody has got jaundice, they are advised not to consume milk, not to consume meat, not to consume good protein food, and they are just given curd rice. Do you advise that? Does it help?
Yeah,
anyway?
Very, very good question, because I get asked this question very, very often in my clinic. Sir, I got jaundice and people are not, my family are not allowing me to eat. I'm feeling hungry, I'm feeling very, very weak, but people are not allowing me to eat. Now, it's actually a misnomer, let me say that, because for liver or any part of the body to recover, we need good amount of protein. And as I said, liver is a big chemical factory. It needs all these proteins to metabolize. Okay. And if you're not eating adequate amount of good diet and protein diet, for example, people say don't eat chicken or don't eat eggs, don't eat any protein. So how will liver recover if you're not giving protein? For the liver to recover, you need a lot of protein. So we actually recommend for these people to take more protein in the diet. Okay, for the proteins are nothing but building blocks of a body. Okay, it helps in regeneration, it helps in repairing a body. So, and if you rob them away, if you rob the person from not getting those proteins, then it is going to make things worse for that person, for that patient. So please do not tell your family members or whoever has got jaundice not to take protein diet. It's very important that they take protein diet. In fact, for our patients with cirrhosis, we actually ask them to take at least 4 to 6 eggs per day, and we actually give protein supplements to these patients so that they get adequate protein. It is very important. So do not, if they want to eat, let them eat. Whatever they want to eat, let them eat. It's very important that they get good amount of nutrition, good amount of protein in the diet so that they can recover quickly.
So another question from our viewers. I have been diagnosed as HBsAg positive. Will vaccination help at this point?
Unfortunately, once you have already got HBsAg positive, vaccination won't work. So vaccination is only to prevent. All the vaccines, as we know, are nothing but to prevent getting that infection or the virus. Okay, but because in your case you already acquired the virus, no point in taking vaccination. But what you can do is you can check your family members, your close contacts, and then if they are negative, you can vaccinate them so that you don't spread the virus to your loved ones. And if you have HBsAg positive, which means you already got the virus, as I said earlier, we need to check what stage this virus is in, how much damage is it happening to the liver, and if needed, we will have to treat you with medications. And as I said, there are excellent medications which are available with very little side effects and hardly any monitoring needed. You can take these treatment medications and you can happily control the virus. Now, I wanted to just reiterate again that these viruses are transmitted, like for example, hepatitis B and C are transmitted through blood and blood products and also through body fluids. Even through saliva, it can get transmitted. The other question I get asked is, if I got hepatitis B, do I need to be treated as untouchable person? That I should not be meeting other people. I cannot share dinner with my family. No, that's all not true. As I said, it is transmitted through the blood. So if you do have a cut, for example, make sure you cover it quickly so that you don't transmit your blood or get contact to other person. Okay. Otherwise, eating on the same dinner table, sharing the plates, sharing the bed is absolutely fine. Okay. But one recommendation is sharing razors and blades, because you can have cuts and that's how you can transmit the virus. So I would not recommend using sharing blades or razors, but eating on the same plate, touching each other, kissing your loved ones is absolutely fine. There's nothing to worry about it. Okay, but it is important that you get your virus checked regularly so that if needed we can treat it.
Sir, in this current scenario, can coronavirus cause hepatitis?
Yeah, as I said, itis means inflammation and hepatitis means inflammation in the liver. And coronavirus, as you know, it comes and affects the lung, but it affects the rest of the body too. And similarly, liver being a big chemical factory, it also takes a hit. In fact, 30 to 40% of people who get admitted to hospital with coronavirus do have abnormal LFTs. They have high liver enzymes. But most of the times, as the virus improves, the liver also recovers. As I said, liver is such a brilliant organ. It recovers, it regenerates. It becomes a normal organ again afterwards. So I would not worry if somebody got liver enzyme elevation because of coronavirus right now, because if you treat the virus, the liver will also automatically improve. You don't need any specific medications for the liver itself. Okay, but make sure that you take all the precautions for the coronavirus, as we've been discussing in the media for such a long time these days. So take all the precautions which is needed, but if you do have abnormal enzymes, we need to check for all the other causes also.
What is the lifespan after liver transplantation?
Now, liver transplant, when it actually was first done, had very poor outcomes. But over the last 30 to 40 years, liver transplant has been a very good success program. Okay. Now, as I said, we do transplant for patients who are very, very sick. Okay. So imagine those patients to start with. Okay. So if you don't do transplant for those sick patients, the life expectancy is less than 50% in a year. So only about 50% of them will be alive next year when they reach the stage of end-stage liver disease where they do require transplant. So 1 out of 2 people die if they don't do transplant. Okay, so these are sick patients we're talking about. Now, if you do transplant for these patients, their success rate or the life expectancy have gone up so significantly that more than 80% of these patients are alive even after 10 years, 20 years and 30 years. Okay, the longest I have seen the liver transplant patient alive till now is 36 years and is still alive. And the risks of liver transplant is in the first 6 months to a year. Once the liver embeds into our body and there is no risk of infection, then they will have a normal lifestyle as any other person. They can go to the work, they have a lot of energy in themselves, and unless you actually tell them they had liver transplant, they would not know that they had a liver transplant. So do not be under the impression that liver transplant is a major surgery, that the outcomes are very poor. No, the outcomes have been excellent throughout the world, and not just their life expectancy have improved, the quality of life have also improved quite significantly for these patients who we do liver transplants. That's partly because of the better patient selections, good surgical techniques, good post-op care, and also we got excellent drugs which help in preventing rejection of these liver, and therefore the liver transplant has been a very successful program.
Sir, any specific precautions that patients who are already diagnosed with liver disease, should they take any specific precautions during this COVID era?
Yeah. So I understand your question that if you do have viral liver diseases, like for example hepatitis, do I need to take extra precautions for the COVID? Now, it's the same precautions that we say for a COVID. There are no extra precautions or specific things that you need to do. And in fact, people who are having autoimmune hepatitis, we suggest them to take the same medications. For a viral hepatitis, we ask them to continue the same treatment. There are no changes in their treatment, but just make sure that you take absolutely all the precautions, universal precautions for coronavirus, because obviously it is a pandemic and we're seeing so many cases these days. So please do all the social distancing, hand sanitizing, keeping a mask all the time, take all the precautions so that you don't get this coronavirus and then also affect your liver. And people who already had liver transplants, we are not suggesting any changes in the treatment for the liver transplant medications, because we have not seen any kind of increased risk of liver rejections or problems with liver transplant. Okay, so we have not changed in terms of medications wise, but having said that, it is absolutely paramount that we take all the precautions for the universal precautions for the corona pandemic.
Under what circumstances do you require liver transplantation?
Now, as I said earlier, there are three main indications or conditions where we actually suggest having a liver transplant. One is the chronic liver disease, which is probably about 70 to 80% of the reasons why we do transplant is chronic liver disease. Okay, as I said, anything chronic means damage happens for a long time. Acute means something the damage happens very, very quickly in a very short space of time. Okay, so chronic liver disease, which causes cirrhosis or scarring of the liver, and when they develop all these complications which we discussed earlier, like ascites or fluid in the tummy and blood vomit and all these complications, and it has come to the stage where liver has become an irreversible damage that has happened to the liver, then we suggest to go for a liver transplant. And as I said, liver transplant we do suggest for people who we estimate. There are different scoring systems which we use internationally that will tell us how sick the liver is. We can grade the liver disease, and based on that, once they reach a particular scores or certain severity, we know that not doing a transplant, the risk of dying is more than 50% in the next year. In fact, if we do leave these patients like that, in the 2-3 years down the line after they've been told that they need liver transplant, if we don't go for liver transplant, all of them, 100% of them die by the end of 2 to 3 years. So it is those patients we suggest to go for a liver transplant. The other indication is people who get acute viral hepatitis, or if they take any drug overdoses and the liver becomes acutely sick at a very short space of time, liver cells die and become necrosed. Those are the patients where we suggest that we should definitely go for a super urgent or an urgent transplant. The third indication or the reason is liver cancers. And as I said, liver cancers, the incidence or the risk of liver cancer is actually rapidly growing. In fact, it is estimated that, in fact, it is said that the fastest growing cancer in the world right now is liver cancer. And again, it makes sense, isn't it? You have alcohol, you have viral hepatitis, which is still there, which is quite rampant, and then you have excess fatty liver, which is depositing in the liver. The three main reasons which are not going to go away in our community, in our society, and because of all these three reasons, liver is getting damaged, and that's why we're seeing high numbers of or rapidly progressing liver cancer. So unless we take all the precautions to stop these risk factors, liver will get damaged and you'll end up having problems in the liver, life-threatening problems. So liver transplant is done for three main reasons. One is chronic liver disease, acute liver failure, and for liver cancers.
So another question from one of our viewers. I started observing yellow discoloration of my eyes about 10 days ago. I took herbal medications as advised by one of my neighbors. I repeated the liver function test. The jaundice did not come down. In fact, it is increasing. What do I do now?
I'm very sorry to hear that, and I'm also concerned because unfortunately the indigenous medicines, which which is very well rampant in India, is causing all the trouble, to be honest. Okay, liver is such a good organ, as I've been telling from the start, that you just had to give rest or remove the insult. For example, if it is alcohol, you remove the alcohol from the body and liver will slowly regenerate unless it has reached the stage of cirrhosis. If it is not reached the stage of cirrhosis, liver will regenerate. Okay, by giving all these indigenous medicines like herbal medicines and stuff, you are poisoning liver or giving more toxins to liver, and it is not helping you to recover. Now, important thing to understand is what is the cause of this liver damage. Is it a viral hepatitis or some other things? As I said, there are 100 and different reasons why liver gets damaged. Unless you actually know the root cause or the actual reason, you will not be able to give specific treatment for these conditions. And again, as I said, most of the times liver do regenerate and recover by itself. We just have to give some time for it to recover. By giving more poisons and more herbal medications, you're actually causing more damage to the liver. So I would not recommend, please, all the viewers, please, if you have any jaundice, please go and check with your doctor, check with the liver specialist. Make sure we understand the reason for it and also follow the instructions rather than blindly taking all these herbal medications. We have seen number of times patients coming to us at a very end stage acute liver failure because of all these herbal medications, and either they die because of it or they go for a liver transplant if they're lucky enough. So please, reviewers, do not take any medications like herbal medications and which does not have any proof to it. Please do not use any of those things. Please consult your liver specialist or a doctor so you can assess the reason and also treat your liver condition.
Sir, any message to our viewers?
Yeah, so ladies and gentlemen, I just want to conclude by saying that we took this opportunity to come in front of you because today is World Hepatitis Day. Okay, now World Health Organization, WHO, has recognized World Hepatitis Day as one of the important days to celebrate, along with the other 9 different days that we celebrate throughout the year. Okay, now the aim of this is to spread the message that these viruses are lifestyle diseases viruses. These are preventable viruses, and unfortunately these viruses, unless they very badly damage liver, you would not recognize it. So therefore I would urge all of them to get yourself checked, which just needs one simple blood test. It will tell us if you got hepatitis or not. If you do have hepatitis, then we can treat it. Okay, and therefore you don't end up into having any serious complications. So it is a treatment. It is a disease where it's easily preventable. It's it can be easily checked, but you have to come forward for getting it checked. The WHO aim is by 2030, it wants to eradicate the virus completely from the world, similar to smallpox. So ladies and gentlemen, please support us, support the World Health Organization in doing our bit to get ourselves checked for these viruses, and so that we know if it is there, we can treat it. If not, if you're negative, please get yourself vaccinated so that you can prevent from getting these deadly infections which can cause life-threatening damage and which are 5 times more common than HIV. Thank you so much for listening.
Thank you so much, sir.